essentially away from poison. Poison is what? Is smoking and alcohol. Yeah, I mean, one glass of wine once or twice a week or on the weekends, that's fine, but nothing more, because alcohol is a very, very harmful thing with menopause and hormone changes. Makes you put on a lot of weight. It makes, again, you more prone to the heart problems, all diabetic potential. So we stop smoking, we stop alcohol. The next, as I said, the crucial is the exercising, and to have like regular classes, not just running or walking dogs, as sometimes say. No, you need to go for a good hour in the gym, have classes that has a combination of weight bearing and cardio, because the weight bearing is the one actually that makes the burning continuous for over 24 hours. So that keeps on going. If you maintain that a good 3 times a week, that will always keep you fit, avoid weight gain, and make the hormones more effective in a lower dose. Because if you have too much fat and you put on a lot of weight, actually a lot of the hormone get lost with this effect of the extra fat, and it disturbs the effect of the hormones. And again, number 3, the lifestyle, which is the diet. So we become enemies, our enemies, we avoid them, which is sugars and carbs. But everything else, mainly focus on high proteins and focus on vegetables, fruits, lots of fluid drinking. So then, if you are avoiding carbs, if you're avoiding sugars, always have the high protein keto diets, have a lot of fluid, vegetables, ensuring that you're having this balance, but take off the poisons of the sugars and the carbs. Then you are saving your risks for the future, and you are making your response to the hormones be best. So you're able to burn and you stop being resistant to insulin. So, and then comes, of course, all the hormone levels must be very meticulously checked. So there is nothing as one solution for all. In other words, you have to check all your hormone levels. Your brain hormone levels is a marker, which is FSH, LH, because these control the ovaries, and simply these hormones go high and they are responsible of the symptoms. So we need to see how high they are. And then we check the estrogen and the testosterone. The testosterone is the hormone of the man that is released from the ovaries, and that also runs out. But the testosterone hormone, for example, is the main hormone responsible for 3 vital things: for sex, libido, desire; for brain, fogginess, and sleep. These are very important. So we have to check, because all women completely become almost nil with testosterone, not knowing how important that is. And the other, of course, which is the estrogen that the ovaries stop producing, because estrogen is like the good hormone or the beneficial hormone. So we replace the hormone of the estrogen, give supplement from outside, but only main drawback of estrogen is if the woman still has a uterus, she always has to have progesterone with the estrogen, because estrogen makes the lining of the womb overgrow, and it can then provoke risks of overgrowing, polyps, or rarely to turn into cancer. But we all don't reach that, because we know we have to give a balance of both estrogen and progesterone. And to surprise of a lot of people who are not aware, again, which we're trying to educate, we also give testosterone for women. So we make a combination, and it differs. How old is the woman? When did she start to go through the change? Because the recipe changes almost could be every year or 2. And the recipe changes in the first 5 years of going through the change to the recipe that needs to be given after menopause and complete cease of the period. So simply, the woman has to have complete hormone checkup, check her physically, gynecologically, and the gynecologist specialist always has to tailor the recipe of the hormones that she takes, and she gets monitored once a year to adjust or change accordingly. And it's always changing, because your body every year changes its desires, its requirements. Sleep, give enough sleep allowance, because deep sleep happens only at night. So women who try to make it up for sleeping during the day is not good. And I always say you need to go to sleep early in the evening, because that's what your body is meant to recover during. If you have to make sure you go to bed quite early, not to stay up all night and then expect when you sleep you will have the same quality of sleep. No, deep sleep early, allow good, at least good 7-8 hours of sleep every night. It's very important. Besides hormones, it's very useful to also use supplements and things that are related to nutrition and diet and herbs. And that's why we always need high doses of vitamin D3. We need CoQ10, fish oil, omega-3. These things all are very useful during this phase, because the immune system is also very hit as a result of the hormone change. So a lot of the supplements, specifically for the menopausal phase onwards, is all related to extra supplements of vitamin D, vitamin B, and a lot of zinc, a lot of antioxidants. All this is very important together with the hormone replacement. Iron is one of the things also that women tend to be very low, and it's responsible for the hair loss, which a lot of women suffer from in menopause. So I always have to check the ferritin levels and also adjust and give extra iron for all these women. So it's not hormones only, it's hormones, it's lifestyle, it's diet requirements and supplements and well-balanced diet. In addition to hormonal change, and not as a replacement, but a very, very now recent and successful up-to-date complementary therapy now is found to be using the radiofrequency treatment. So we treat the body first with the correct hormones, and then once that is optimized, the effect brings the body able then to respond to what we call radiofrequency sessions, which are simply non-invasive. They are not surgical, but they help a lot with vaginal discomfort, sex discomfort, sexual desire and libido in women, women who tend to have prolapse at the menopause as well, because all the muscles have gone weak, urinary incontinence and leak, which is the urinary problems that the women suffer from. So that has now recently, only in the last couple of years, started to give very good results alongside with the hormones, because this is simply sessions of radiofrequency treatment done vaginally down below by a probe, like similar to the scan probe. It's done in the outpatient clinic. I do it for my patients without any anesthetic, without any interventions. And it's like an investigation, like the scanning takes about 20 minutes. Simply, it transmits radiofrequency waves that promote the collagen under the skin to build up. It's the same as what is used for aesthetics, for the skin aesthetics, which is used a lot in cosmetics. It has been found to be very useful in building up the collagen, the integrity of all the vaginal wall, the back floor, the bladder support, the vaginal support, and the skin integrity. So that gets gradually back to becoming as young as teenager time. So that's one of the things now I've been working lately on, and I'm seeing very good results with. Yes, as I said, because that struggle is a false actual accusation. It is simply always because the women have not been seen by a specialist gynecologist to properly assess the whole medical conditions of the patient, the whole hormone profile, and couldn't tailor the right recipe. Like in the past, we used to give hormone replacement, all originating from horse urine. We stopped that. And this used to be in the form of tablets. We now use natural, almost mimicking or similar, like the natural hormones, but they are produced by plants. We extract them from plants. And these are actually not given orally, because the orally are the more artificial that were found to have more side effects, more risks, more complications. So the world has changed, that hormone replacement is better, more healthy, and much more effective and least risky by giving it non-oral, which is by means of skin. There is gels, there is patches, there is pessaries that are given vaginally. So it's a combined recipe. And as I said, there will be the first 5 years, always till your menopause is complete, you will have a recipe that gives you still a period every month. While after we finish menopause complete, which is usually around the age of 53, 54, we can switch to something called combined continuous, that we stop having periods. And there are also other ways. We need, as I said, if the woman has a uterus, the uterus priority must be protected by having progesterone. But it's the estrogen and the testosterone gives the beneficial and the clearance and the treatment. So definitely, I don't believe there is struggling or absolute contraindications and the fear we used to face with the wrong dilemma that happened with the study that made everybody panic about the risks of cancers. Now we know very well that the benefits far outweigh the risk, so long as the woman is seen by the right specialist, having the right recipe, and followed on every year to make sure that she is correctly up to date with her adjustments.